Canon family and friends. I want to start today with the president's initiation for vaccination. And as you know, that Carla has just returned back from the White House. And this is our leader, Carla Brown, door-to-door campaign for vaccination and Canon Hospice. So it's been a core vaccination campaign. And as you guys know, that people that have wanted to get vaccinated have already been vaccinated. And there is still, I believe, there's a 15 million Americans that have not received their second shot. So if somebody has missed a second shot, that I think, is a time to remind them to go get their second shot. But in any event, this has been the core essence in the vaccination campaign, door-to-door campaign. But unfortunately, there are some oppositions to it. And obviously, as you see up here in Missouri, there's been a big spike in Delta variant of the COVID-19. And the sad part is that there is a reminiscence of March 2020, where the hospitals running out of the ventilators. So that is a situation evidently has been reported. And the other additional thing that of a big concern is the governor is pushing back, in fact, stopping the door-to-door campaign in Missouri. And that's something that's of a great concern. And as you see here, our Louisiana governor, John Bel Edwards, has had a press conference where Carla Brown was there, and he has strongly encouraged, and I believe he's supporting door-to-door campaign very much. And you might ask as to if you are fully vaccinated, can you get Delta? Yes, you can get. As you know that these Pfizer, Moderna vaccines that you may have had, or even Johnson & Johnson, is not 100% protective. So you do have even if you are protected, Delta variants evidently can reduce the immunity. And that is of a recent news out of the Israel, where almost 100% of them are vaccinated with the Pfizer, and they have noted a drop in their immunity. So there is a concern. So this is something I think I'm going to focus a little bit later. But to question that, do we need a booster? Pfizer is applying for a booster, but at this present time, that Dr. Fauci, the nation's infectious disease doctor, and the CDC does not recommend any booster at this present time. And obviously, let's look at some of the concerns for those people that do not want to get vaccinated. One of them is misinformation. Look at this, no masks, and they're not going to get vaccinated. You might be thinking it's a small fraction. You're looking at least 10 to 15% of Americans in this category. Just imagine, they're saying fake pandemic. Hello, we have almost 4 million people died all over the world. It's real. It's the pandemic of the century. Then you have a Black mistrust and the minorities. So they're not sure if this vaccine is effective, or maybe perhaps it's an experiment. And that's in fact the reason why Moderna and Pfizer are pushing for a full approval of the vaccination, not the emergency use authorization that we have at this present time. And whatever the reason may be, but our own neighbors, Mississippi, looks like there is a increased hospitalization in that state. 95% of these hospitalizations are in the unvaccinated people. And sadly, I have 2 patients right now. Both of them, their families have not been vaccinated, and both of them are in the intensive care unit. So could you imagine that they can not only prevent the sickness, but also death? And lastly, I want to actually put in some recommendations from Mississippi because of the increased COVID cases and hospitalizations. All Mississippians 12 years and above should receive COVID vaccine. All those unvaccinated should wear masks when indoor and public settings. All Mississippi residents 65 and above should avoid all indoor mass gatherings, regardless of the vaccination status. So the last thing is, even if you're vaccinated and if you have some multiple comorbid conditions, you really need to stay away from the masses and use masks and social distancing and other measures. So, and I think, I see both Carla Brown is here and then Beth. So I want to go ahead and actually have each of them in order to say a few words. Carla, go ahead. Okay, if Carla has
give an update. Right now, we are still going door to door. We are in great need of having other nurses if they can help join our team. We have both Pfizer and Moderna. Our campaign is expanded now, as Dr. Akula just said, to try to help inoculate students that's in school. We are still, our target is the elderly population. I know you've heard the president now, Joe Biden, is also supporting the campaign of going door to door. We are currently right now at 1,400 being vaccinated, getting close to my goal, and I hope to go beyond that. But I still need that Spanish person that can help me in the Spanish community. There's a need because we want to reach everyone. It's not just particular people, but everyone that we can.
All right, Carla, is Beth or Mississippi able to say a few words?
Yes. So here in Mississippi, we are encouraging all of our staff, patients, caregivers to take the COVID vaccine. We are limiting visitors in our inpatient unit, wearing masks, doing hand washing, and educating a lot on the COVID-19